Yes, I can hear you.
That it could be here. Yeah. Like, yeah, go ahead. Oh, yeah. I really think I can. I can't do it. And these meetings, but as long as I can go, that's crazy. I'll be honest. If you check your oxygen levels, they're actually legally hazardous to you. Basically, it has that stuff down at the area, oxygen machine. You test your oxygen levels and stuff that are being introduced into your body. There's certain percentages, so like I say, get out of the room, get out of the room. My boss can be videos, my boss can be videos, and doing that, it's like, you can't do it. TCA, that topic there. Which one? I haven't heard yet. We're in a meeting. Bakersfield. Bakersfield? No. We're the same age. Oh, the airplane. The well, Yvonne,
Yes,
you can let Anna Ringel in
okay,
and Blake Manning.
okay.
That's in there. We're already recording. Right.
That tells you how I am. You know, I didn't get coffee until we went off coffee this morning. And I was like, number one.
I just called it.
It's like, I have to provide Alma with a temporary coffee mate. Because one closes after lunch. She can't function when they just want coffee.
All right, call the meeting to order at 1:30. I am Vice Mayor Todd Lance. I'm here with, I'll let everyone introduce themselves. You want to go around the table?
Sure. Thank you, Chair, Vice Mayor. I'm Dave Kelly, City Manager.
Kevin Thompson, Assistant City Manager.
Martha Cruz, Mayor.
Jason Ferguson, Police Chief. Thank you all for joining us in our Cloverdale Homelessness Community Advisory Group meeting. We are here in the Cloverdale Regional Library, and we have several people as our panelists virtually. So if you would mind, Yvonne, could you
Yes.
go through and introduce everybody, or have them introduce themselves if you don't mind? You're starting with yourself.
Oh, yes, I'm Yvonne Spence. I am a interim city clerk for the city of Cloverdale. And I will be taking the notes today's meeting.
Thank you.
Okay, Jody, would you like to introduce yourself?
I am Jody Kane. I'm with Alexandra Valley Healthcare. I'm the behavioral health case manager here.
Thank you. Susie Holmes? Oh, let's unmute you.
Thank you.
Okay,
Hi,
there
I'm
you go.
Susie Holmes. I'm the finance director for the city of Cloverdale.
Thank you. Michael?
Good afternoon. Michael Velasquez with St. Vincent de Paul.
And Margaret?
I'm Margaret Slake. I'm the CEO at Reach for Home.
Great. Blake Manning?
Good afternoon. My name is Blake Manning. I'm the substance use disorder counselor at Alexandra Valley Healthcare.
Great. Anna?
Hi, everyone. My name is Anna. I'm the Director of Operations at Reach for Home.
Great. Jess? Not sure if Jess is there. How about Colleen?
Hi, everybody. Colleen Halbom, Executive Director for Wallace House CCOC.
Thank you, Yvonne. And we have one more person who just came into the room with us. I'll let her introduce herself really quick.
Hi, Debbie Howe from Alexander Valley Healthcare.
All right, thank you. So the first thing on our agenda is the update on local homelessness activities with AVH, Wallace House, and Reach for Home. Debbie, would you like to start?
Sure. So we met on August 23rd, and we just did a quick assessment of the resources available and and kind of determined our goal for the meeting, which was to strategize on ways we could collaborate and coordinate between our mutual clients. That sent me off with some tasks to undertake, and I did quite a bit of research and developed what our population that we're serving consists of, and identified all the people within our system that identify as homeless, and then where they're from and the ages and the communities they live in. So the bottom line is we have lots of work and lots of possibilities to work with here. And in talking with Reach from Home, one of the things that became very clear is that the homeless population that we serve in and in the community, most of them are not in the coordinated entry system, so they don't have access to open beds. For example, Reach from Home had one open bed in permanent supported housing, but without our clients enrolled in the coordinated system, we couldn't refer them or even communicate about them. So one of the first steps that we thought about was developing a time that Reach from Home may be located at our site and conduct appointments for coordinated entry, working with our case managers and our staff that do eligibility assistance. We identified the patients or the clients that we have that are already enrolled in that account, which makes it a lot easier to apply for HUD vouchers. Lots and lots of data on all those things. So we're feeling pretty good. Today I received another form from Margaret from Reach from Home on how to share energy. We need that too right now. Information with each other about mutual clients. Get a release of information form, and it can be adapted and adjusted to meet the needs of our HIPAA requirements and our patients' privacy. So we'll be working on that in the next few days, and probably next week. And then finalizing the actual process where we can work together and get people enrolled in the coordinated system, even though I am told and am aware that that is not always guaranteed housing. The wait is like 200 something days, but at least it's a start. At least it gets them into the system. So that's where we're at right now. Any questions?
So for this to collaborate and everyone to work together, right now we have the main players in our town to create this coalition or whatever, however you want to call it. If Margaret has somebody that comes to her, or Colleen has someone that comes to her, and they want to share the information, would they use Alexander Valley Healthcare as creating that person's personal health provider and their primary care provider? That way the information started with you and worked the way through it. Is that how you would want to?
Well, pretty much most of the ones are already established with us for primary care, medical services, which includes case management. So what we would do is if they aren't established with us, then Reach from Home staff would refer them to us. The clients always have the ability to go wherever they want to go. So if them saying, yes, I want to go with them. If they did want to secure their primary care with our facility, then what Reach for Home would do in their engagement, or Wallace House, or anyone would do would be to get them to agree to share information, and then we could collaborate together on available resources out in the community, throughout the county and locally.
And Margaret, I see your hand, so I'm going to just say something real quick, and I'm going to call on you. I know Margaret and Reach for Home has started a spreadsheet type of information gathering on all the people in Cloverdale that shows who they are, where they live, and what services they would like to have. We discovered we needed to add a little bit more to it and update, keep things going, just so that we can follow and track people a little bit better. I also recently found out the county has a program that does this already, and I don't know anything about it, and I want to dig into it. It's called Access, and it's not being utilized, but I guess this is what it's for. And so if we don't want to reinvent the wheel that Margaret has already started on, that might be something we look into as well to help us out with. Margaret, please go ahead. I saw your hand.
Yeah, well, to chime in really quick on Access, it's a little bit of the same, but it's also kind of different. So we might want to see where the overlap is and where it isn't. It also is flooded with Santa Rosa. So I think, you know, we might want to take some best practices from what they're doing, but I don't know if we would be able to fit in, but it's a good point and we should definitely look at it. I was just going to elaborate on, we just got trained and we're up and running and being able to pull names from coordinated entry to see who's in coordinated entry. So that's all up and running. And as of yesterday, I believe, we can now pull names directly without going to coordinated entry and asking for that request. So we'll be able to pull reports and see who has been entered in and how long they've been in there and those sorts of things that we can kind of lay over the information that Debbie just described, and then also lay that over the spreadsheet we have. So it'll be 3 different data points and we can see where they all intersect, and we can work as a team to help individualize how we're getting people through the system and out of homelessness and into a solution. So I just wanted to let everyone know that we did get access to that information yesterday.
Awesome, Margaret.
So the next thing I would ask is, now that you have the larger players that have most of the information, how do we take somebody like Michael and St. Vincent de Paul and start utilizing their services they're offering to have us there, or something to start working with them, so that we're not trying to chase people all around? When Michael's doing his services, is there a way for us to collaborate with him as well and bring people like him or Catholic Charities and all these into the mix with this? So
I can chime in, and Michael, I'm sure you could chime in too, but on Tuesdays at St. Vincent de Paul, now that you guys are up and running again, and I was just talking to Zeke Guzman about this the other day, but we have all of the services Michael's providing, plus we're out there with coordinated entry, plus Providence is now out there with their mobile clinic. And then we're also going to be out there with our community health and wellness clinic, which can help get people signed up and over to Alexander Valley as well. So we've kind of concentrated our efforts on Tuesdays in hopes to be a hub to kind of get people into the system that way. And then Debbie, we can also talk about if you want another day for us to do coordinated entry over at Alexander Valley exclusively, but I think Tuesdays are a great place to start.
Debbie, anything on that?
Oh, we'll definitely want to coordinate them and work with them on other days if they're there. I think once we have a location where we can actually promote the signing up for the resources available, and we can get it filled and a poll of individual circumstances are, that would be very, very helpful.
Madam Mayor?
Yes, I just want to emphasize the importance of this collaboration, because as I mentioned before, part of the problem is that, stakeholders are not talking to one another. And this is essential, not to reinvent the wheel, not to waste resources, and at the same time, to continue to advance towards our objective. So I thank Margaret and Debbie, as well as Steve, and everybody else involved. Michael, you're essential in this collaboration, and we need to figure out how this is all gonna look soon.
So, Michael, I know I told you.
Is the volume turned up on your computer?
Yeah.
Where you wanted the
And
button.
nothing's coming out?
Just give us 1 second. We're trying to fix the audio in the room here.
So Kevin, you were saying that there's some sort of microphone up here?
There is a microphone, but
Last time we had.
Whoever is talking, we can hear you loud and clear. Like your voice is perfect.
We can't hear you guys very well, Margaret. There's no sound in this room.
All we can hear is from the computer, so it's
that's weird. I mean, oh, no.
Well,
These-
whatever.
Yeah, no, this is weird. I wonder why it's going through your computer audio instead of this audio.
Yeah.
Which it shouldn't be doing.
I can check.
Yeah, check your audio. Oh, you're on a.
Zoom.
Yeah.
Let's see. Okay, I wanna get that.
So you're on your default audio.
Right. With the webcam audio, that's picking up.
Yeah,
I don't
so
know what the FTJ is.
I think that's this. No, it's that.
last time we had that we passed around.
Oh, I don't
You
know.
had what? The
We had
microphone?
micro, so
Can you, can you hear me, Yvonne?
I can hear you. Yes.
Can you do test real quick?
Testing.
There we go, perfect.
we got
We
it.
got it.
You got it?
Yeah.
Which
Thank
one
you.
did you choose?
I used that F3.
Okay, you
And
did.
now it's perfect.
Okay.
Everything else was working good. Thank you.
Yeah, you're welcome.
It was just a setting.
Yeah, I figured it. I forgot to turn that on. Sorry about that.
Sorry for the delay, everybody. I think we can hear you great now.
Okay, Michael, so what I was saying is I kind of threw you under the bus right here and didn't tell you exactly why I wanted to have you here. But I wanted to have you here because I want to see how you feel about this collaboration we're trying to start and how we can take advantage of the services that you offer since you've created such a great program.
Well, thank you. But the collaboration, St. Vincent de Paul on Tuesdays, now that we're back up running partially outside following the county health guidelines, the collaboration is really coming from the external support of the organizations that have further information and support from our clients, like Reach for Home, Jody, Debbie, and Blake from Alexander Valley, and Catholic Charities, and the others. We're a physical place for them to meet the clients. Since we initiated a week ago, things are just, all the moving parts are starting to come together. We're getting a lot of the family type that are in need of support from the different organizations, and are able to talk to real life people that are at least getting information about help with rent, medical services, and other job employment and things like that. I know that the outreach team from Reach for Home are working. They're out there. We haven't seen them yet at St. Vincent on Tuesday, but I know that they're eventually going to show up and be part of the team there at St. Vincent. But I do know that they're in our community doing their great work. Eventually, the collaboration is going on. It's a little hit and miss. This list that has been talked about has been much needed. Blake and I this morning at St. Vincent, the parish, were talking about those clients that we know that have been here for at least 4 years. And yes, they are part of the everyday issues with the police department, the sheriff's office, and some of the other issues that go on. They have not come to St. Vincent this last 2 weeks, and I think there's a lot of reasons, but one, they have to walk there. Two, right now, since we're only giving groceries and we're not giving a meal inside the parish hall because of COVID, they're not coming. A box of groceries to them is pretty much foreign for them living in a breezeway in a doorway out on the river, wherever they're living. So that part that we're providing isn't really in their need. And the other thing is that they've been through the process, and some of them are mentally incapable of going into the system and staying there. Not saying that they don't need it, they do. It's just going to take time. But the collaboration that has been going on, that is being initiated, this one list, we really have to get it to where all of us can go to that list and assist with usable information for the client and for the organization that's going to help them. But we're moving in the right direction. I know that there's still a lot of issues, but we welcome all of the external services that are supporting what we're doing at St. Vincent. Thanks, Todd.
Thank you, Michael. Anyone else on the phone?
I'll just thank you, Michael. I appreciate everything you do. I know it's very valuable. I think I picked up on a couple of things you said, and I agree with you about some of the individuals that aren't capable by mental health standards or whatever other standard, or they just choose not to. I think one of the things that continues to be a frustration is the word time and giving it time, and it takes time. We have done so much over a long period of time for specifically some of these people, and I can't help but get frustrated when I see the calls, and I'm going to talk a little bit about that when we get there, because we're not getting any answers, but yet time keeps going, and we keep dealing with this for extended periods and the same individuals. I agree with you. I think we're talking about the same ones. They need that help, but time is not helping them. This delayed response is actually hurting them, and that's where I'm having troubles with what's available, what can help these folks, how do we get them there? I'm more than willing to get them there. They got to stay. We're going to give them the help. So the time thing is something we continually do, but we're just not getting the answers. And so I just wanted to make that comment. I appreciate everything you do. I certainly am not trying to sound negative about it. Just my frustration continues every time we meet, especially these. I'm still producing significant calls, significant numbers, but yet we're still not able to get the responses no matter what actions we take. So,
which is why we started this whole, or trying to start this whole coalition, is because nobody ever has an answer for anyone. It's always, months down the road for each person that wants help, and by then it's too late. All the way from the single father who doesn't make enough money to get by, all the way to the ones that the chief is talking about currently. So that's why I turn to people like Debbie and to Margaret, and even threw a test person out to Margaret and said, okay, how do we help this person? Maybe they have a criminal history, maybe they have substance abuse, maybe they have mental health issues. Every one of these things stops them from getting help. So I'm not homeless. I'm the only one left. So what are we doing to help the people that are out there? And that's where I'm turning to the only people that know are people like Margaret and Debbie and our groups to say, truly, how do we get a voucher in their hand? How do we get their butt in a room? Because if there's all these technicalities, no one can get it. I have a guy on the river right now. He has one assault charge on his record, and he can't get help. Tell me why. Doesn't mean he's a bad person. It means that sometimes he pushed somebody, or he could even scream with a hose. I don't know what it was, but it's an assault charge. So those are the answers that we're looking for. And then once we find and say we have somebody by the name of Connie. Well, say maybe Connie needs help, we have the plan for Connie before she steps in the door. Or she steps in and you can sit her down at Margaret's desk in Alexander Valley Healthcare and work through the process right there in front of her instead of giving her a phone number to call. Because giving her a phone number, she'll never make that call. Because maybe she's 5150 or she's on meth or drunk at 10 a.m. Could be any of these things. So that's why we need the one-stop shop and people that will actually hold their hand through the process and get it done and get the vouchers. Margaret, you mentioned that there's tons of money you can't, that's why we're doing this, because there's so much money that you'd rather work together to give it away than try to fight for it, because so much we're trying to give it away and we see that even you're having difficulties. How do we circumvent this?
Yeah, and part of it, Todd, is to your point. People, we need to work at, on Tuesdays at St. Vincent de Paul or, the entry point of Alexander Valley. And I think that's why this collaboration is so important, because we need to get the assault charge expunged, or can we somehow get past that assault charge? We need people to be document ready. They need to start working on, even their credit scores, believe it or not, because you're not going to get a rental on a voucher if you don't have a certain credit score. So we're kind of also taking a step back and thinking, okay, how can we get people ready for this stuff while they're out unsheltered, and hitting them at those times when they're able to kind of work on this stuff, and what does that look like, and how do we do it? And I think that all goes back to that by names and kind of each individual person that we're, that this collaboration is starting to work on, which is exciting.
I think also top of your mind is, as a city, that we're gonna have to determine what we're gonna do and what things are we gonna go to meet this need in this community, because there's your one population of high need. And then there's a whole nother population that we deal with often. I mean, we have 60 homeless in Cloverdale, and they range in their ages. And those are not the people on the street. They're not the ones down at the river. They may be living in their car. I mean, what we need to start thinking about, what's our plan as a community to have access to services daily. It can't be once a week. I mean, they don't show up once a week. They get desperate in the moment, and when we have resources available to them and a place to steer them, that's half the key. That's half the battle right there. And then they got to be walked through everything. Our colleagues said this many times. They need total wraparound services, and those require staff, and they require a location, et cetera, et cetera. So, I mean, we're going to really hit the problem. We're going to have to address that issue. Whether people want to agree with it or not, the problem's not going away. The police chief has just told us he's continually dealing with this, so we're just kicking the can down the road, basically.
I don't see any hands. Does anybody? Oh, there we go. Michael, please. Michael, unmute yourself.
I'm trying to figure out how to say this. I'll take the time frame of the last year and a half since COVID, but from the previous couple of years, with the help of everybody on this call, from Colleen to Anna, to everybody at the outreach team at Reach for Home, and the case managers at Alexander Healthcare Center. There's several slices or slides in this carousel where somebody said the single father. We have helped just in the last year and a half, St. Vincent de Paul, through our donations, we spent over $25,000 in rent and lease to keep people, individuals and families in their homes. So the collaboration here is working. I know that there are a lot of different issues that come up that the city is facing with a homeless crisis, but like some have said, the homeless just aren't the ones out on the river. But we have been making a lot of steps to keep people in our community in their homes, to keep them as a whole family in their homes, to keep them able to go work in a working vehicle. So there's a whole lot of plus and minuses, if you want, of all the things that we're doing in this collaboration, but they've all got to be captured, just not negativity. And I'm not saying that that's what we're doing, but yeah, there's a graph chart that goes up and down of all the things that are going on that we're trying to take care of the issues. But a lot of it is working because of the collaboration.
No, I agree, and thank you for all you're doing, Michael. It's great for St. Vincent de Paul. I'm trying to find ways as well to get it through the county and state money and the vouchers and things that are offered to them as well, not just the out-of-pocket private money, but that's phenomenal what you guys are doing, and we all appreciate it for sure. And I'm just trying to tap into other sources at the same time, you know, get as many people in there as possible, because if 92 people walked in St. Vincent de Paul's door tomorrow, it wouldn't be able to survive. And so we have to find ways to get our county and our state money wrapped into this as well. I know that we've been down at the river doing vegetation management, speaking to everyone down there, and there isn't one single person down there that would qualify for any of these vouchers that we've contacted, and that's the sad part. So we move them out of their homes and offer them nothing. And then we turn around and talk a big game here. And that's what, you know, I feel like we just spin our wheels, and we're not getting anywhere because we try to do the right thing and it just stops at our level or beyond us. So any other questions or comments? I don't see any more hands. Oh, Colleen, please.
So I still am very focused on behavioral health not being present. So I know that when we had St. Vincent de Paul operating before, we had somebody come up from behavioral health that was there fairly routinely. I don't know if there are any plans for that to happen again, but the folks that you guys are talking about that may have a criminal background or have severe mental illness or both, those folks are going to have to be triaged through behavioral health and possibly placed in a Buckaloo or Community Support Network, where we had our one lady who got hit by the car. She was at CSN and then left. That still leaves the problem of them being able to leave. But, you know, if we don't really focus on that need in that way, we're really just spinning our wheels. We need to get behavioral health plugged in.
Well, supposedly, I just read a document from the county that Sonoma County Mental Health has an outreach station in Cloverdale, which I know they do. They used to rent from us actually, and but no one knows who's there anymore. They've changed, you know, staffing, etc. So that's one of the questions that I have for Sonoma County Mental Health Department, and maybe we can get them involved on Tuesdays. But again, once a day, once a week is not sufficient. It's not going to work.
It's not.
To get on the ground resources that are available, and it has to be locally. We can't send people away to access services. The homeless people. I mean, come on, it's not even realistic. And we can't wait for laws to get implemented. Otherwise, it's just going to continue to grow.
And I called Hart last week to go out the river, and they refused.
Yeah.
So we're getting no help from the county end of this for other services. So we're on our own, and that's why we're doing this. We need to create something here. And I'll tell you, our next item is the homelessness task force for Northern Sonoma County, and this is the program that they're trying to figure out how to create. They're trying to look for solutions, and I think we're months ahead of them at this point. So I think that whatever we do, they'll end up kind of mirroring it, but they're not offering us anything coming from Hart in places like that right now. Is he the one who's going to do that?
Steven's from my and
David, is that your update for the homelessness task force?
So Steven is from mine.
I know.
Chair, when you're ready, I'm happy to provide and share an update.
Please.
Okay. And I do want to introduce, and I realize I'm going to put them on the spot a little bit, but Steven Sotomayor, he leads up housing and homelessness for the city of Healdsburg. And he worked with Reach for Home and the county to do a presentation to the city, Healdsburg City Council last evening. Did a great job, Steven, by the way. And he's also our representative on the Sonoma County Continuum of Care Board, which is working on addressing the funding situation and also strategic, countywide strategic plan through the Continuum of Care to address a lot of these issues. Stephen also participates, as do the chief, Kevin and I, on what's referred to as the Northern Sonoma County Homelessness Planning Task Force. This is led up or was initiated by our fourth district supervisor Gore. He hired a facilitator, Dr. BJ Bishop, to lead up this planning effort. And it started pre-COVID and was kind of sidelined a little bit, but we've got moving again. And the result has been really a development of 6 strategies. Those 6 strategies include community engagement, emergency shelter and interim housing, street outreach, coordinated entry, prevention and diversion, and the last but not least, permanent housing. The task force at the last meeting, which was they're usually held monthly, was on August 25th, and there were each one of those groups was led up by one of the members of that subgroup, where we developed kind of specific work plans and a breakout discussion. The intent is to kind of develop more specific initiatives around each one of those 6 goals that can be pursued to address specific issues. And that's in process. And again, the intent is to come away with a strategic plan for Northern Sonoma County, which the geographic area that's intended to cover is kind of Windsor North. So Windsor, Healdsburg, Cloverdale, and then the unincorporated area surrounding those 3 incorporated cities. So the representation of that of the task force really reflects that geographic area. So at this point, we continue to the task force continues to kind of refine the initiatives in the work plan for this 5-year strategic plan. We continue to discuss more, again, very specific focused initiatives that can be pursued. There is a particular interest that's been expressed by the board of supervisors around emergency shelter and interim housing. The county has announced that there is funding available for establishing a state parking program, and they're kind of looking to. That's one area where they're looking to Cloverdale to see if we'd be amenable to that type of program. We haven't had really a policy discussion either at the Homeless Committee or at the council around that, but the county board is pursuing that as a strategy, and they're looking for us to kind of whether we support that kind of a program as one of our local initiatives in Cloverdale. There's also initiatives, I think, Healdsburg's kind of taking the lead on the interim housing and finding maybe a location for kind of the indoor-outdoor encampment similar to Las Gilcos Village. Whether it's tied into this task force group or not, I'm not sure. It's both a collaboration with the city and the county. But that's the chair and members of the committee. That's kind of an overview of the process at this point. And it's a work in progress, and we'll continue to develop some of the strategic initiatives. I know some of the members that are participants here, including Margaret from Reach from Home, are participants, as well as again Stephen Sotomayor.
May I ask if that document should be provided to the chair so that it can be in the file? Or do you have it?
Yes.
Okay. Okay, no, I'm just trying to get it at all.
Oh, yeah, I'm in all these meetings, and I know the whole thing. Yeah. Stephen, do you have anything you want to add to that, or you want to introduce yourself to everyone? I don't think
Yeah.
this is your first meeting.
Thank you very much, Stephen Sotomayor, Housing Administrator, City of Healdsburg, as well as the member representing the North County on the continuum of care. I think the update that was provided is exactly what I would have said around the different initiatives. Last night, the Healdsburg City Council received an update, including Reach for Homes enumeration of those experiencing homelessness, and really took a hard look at temporary shelters and gave direction to staff to go after and look at some sites that could accommodate that in the North County, as that's the one piece that's really missing. One thing that you can look at in the homeless counts is the percentage of those sheltered in the North County is far below what is in the rest of the county geographically. And while we're pushing forward with these initiatives, that's become a top priority in the North County Homelessness Task Force as we work through those tactics. Well, in Healdsburg, we do plan to bring back that North County plan to the council for final consideration once those tactics have been finalized. But the presentation that we put together last night, I'm happy to do the same with the county about larger COC planning initiatives and how that will tie into the existing plans, such as Cloverdale's. Petaluma's working on one, Santa Rosa's beginning the process. The North County has one. So stitching those all together to make sure that resources are used in an effective manner countywide will be a top priority for that committee. The first thing that we'll focus on is the new HAP funding that's coming through the state, and we have to submit an action plan for the entire county by June of 2022. So the committee will take that on to make sure that those monies are put out in effective ways to sustain existing programs, as well as to expand upon what's already within our infrastructure and our continuum of care. So happy to provide that report whenever it's convenient. Thank you for the introduction. I was very interested to hear today's conversation. It was just in the audience, but happy to share. Thank you.
Thank you, Stephen. Any questions or comments?
Well, I think Stephen will provide a thorough report to council down the road in the near future.
Sounds good. Okay, seeing no hands, we'll move forward. Update from Police Chief Ferguson on police response to homelessness.
Yeah, thank you, Tremaine. I don't have much more than what we reported last time, but I do want to give some numbers here just to kind of put it in perspective about what I kind of addressed already and what's going to continually be something I provide every time we meet every month, because it's just, I think it's important, because one thing that I agree 100% with Michael is there are circumstances where this is working very well for those individuals that meet that criteria and qualify. The challenge for all of us is what are we doing about those that it's not working for? What are we going to do about these? I think 4 were addressed last time we were in that meeting when I was asked, what's how can we solve this? Basically, it's 4 people in crisis that need that attention. And the system is not working for them. So the challenge is how do we get them taken care of? Because clearly they're not going to qualify for any type of housing. At this point, apparently they're not even qualified for any kind of mental health facility, which it blows my mind. I'd be all in favor of the mental health crisis response team being here once a week, so long as their end result is sustainable and comes up with solutions. But to meet here once, twice, 3 a week with the same people and have the same outcome is just not acceptable. Because I think we all know the 4 individuals I'm talking to should not be on the street. And every attempt to put them somewhere and deal with crisis does not come up with anything sustainable. So with that being said, we continue to address issues in the plaza. I'm still fortunate it's all come down, but they filter out to different areas. We have been doing active patrols in the River Park. Sergeant's been out there 4 different times. I know myself and Lieutenant have also been out there. So we're still actively keeping an eye on everything, even outside the plaza, outside the where we're typically used to dealing with in the business district. So since our last meeting on August 10th, we've had 35 total calls for service relative to it's all basically 3 out of the 4 individuals that that we've already addressed, and we know who they are. The female individual, 7 different calls. She's called our dispatchers 6 different times, nonsensical type conversations. The young man who lost an appendage, who we all know, 17 different calls for that individual. And then another individual who happens to have a significant alcohol problem, 11 different calls on that. So, and 6 times contacted our dispatch center. Again, not reporting anything, but speaking nonsensical terms of, which relates to us pulling out. But, this is going to be a continual problem. This is kind of what I said about time. I think I've given these staff reports since we began this thing. And we're seeing those numbers steady or increasing each time, but no resolve for these individuals. We have done our part to 5150 them. Unfortunately, it does lead to arrest. One of these individuals, the same warrant 6 times. So I don't know what the resolve for that is. I don't know how to fix that. So I think the challenge for all of us in here is to really try to put some focus on these 4 individuals that need assistance, that are in crisis, that have to be addressed. Because I think the other ones, everybody here is doing a fine job of getting them everything that they can get, and it's working. I agree. The other ones, nothing's working for them, and we're going to need to come up with a solution to that. That's really our challenge, and that's really all I have to report. Unless somebody has some questions.
Who can we get to help get behavioral services up here, at least on Tuesdays?
No, we're not mental health.
So who has any type of good polls, Henry, you've been here? Margaret, you can.
This is Margaret. I'm wondering, and I was actually going to send an email, Todd, Debbie, Colleen. I'm wondering if we can start having a meeting to just discuss these particular individuals. And I think, because I think that the strategy is going to be a little bit different than just having behavioral health there on Tuesdays, because they might not even show up on Tuesdays, the people we're talking about. I think what would be more strategic and maybe better is if we could come together with the police chief, and I might be able to pull in someone from the crisis stabilization unit that I just had a very good experience with, and they might be able to kind of guide us through how to help these particular individuals. So I'm wondering if we could take it offline and kind of have a, just a separate meeting to kind of strategize those specific individuals and start there.
I think that's an excellent, that's an excellent idea, Margaret. That's the whole idea that I was mentioning about triage.
Mm-hmm.
If we can plug somebody into this conversation from behavioral health. Debbie, do you have somebody that comes to the clinic from behavioral health, or somebody that's assigned?
No, they don't come up here, and they don't, from Sonoma County Mental Health. No, we have mental health providers, but not from Sonoma County Mental Health, which is the department that would deal with this level of mental illness. And in fact, they have on their website that they are in collaboration with our police department and the SQHC, which is us. And I don't know them, and no one on my staff knows them, and I don't think Steve Ferguson knows them. So I agree with Margaret. Having them at the Tuesday thing is really pretty pointless, but I'm not saying not to try, but I don't think they're going to do anything.
Well, and
Right.
I think the issue is if you just have it doesn't hurt to have a mental health care provider there, but I think we all know people have to be ready for that. And especially with these people that Chief Ferguson just mentioned, these are not people that are going to just show up and get mental health. Like, we're going to have a strategy to kind of, push them into the system somehow, if possible. We just had a situation in Healdsburg where 5150'd someone. They got all the way to Creekside, they got stabilized, they got on the right dose of their medicine, and somehow they bounced back out of the system on the street, no meds, don't know how it happened, but they did. And I was able to work with someone at the CSU in behavioral health for Sonoma County, and they were able to get them back into the system. And so far they're back in, and the plan is that they're not going to be released back into homelessness without medication and without help. So If we can leverage that situation and pull in that success and help these other people, we might be able to make some progress. Can't promise, but it's worth a shot.
And I think if all of us team up on, I didn't mean to interrupt, sorry, if all of us team up on that and address what you just said about how they get brought in from a mental health standpoint and immediately kicked back on the street. You talk about forcing that issue and making it happen 7 times for one individual, 7 times. And the end result was exactly the same. Now, that's where we have to come together and almost really take a stance that we're not going to accept this for these individuals. And I think the more people that are part of this group that are in this, and I'll bring all the stats they need the 7 times we did it. I'm more than happy to do that. But I think that's what it's going to take. Because we've not started enforcing it.
You are spot on. It took the Healdsburg Police Department and working with the officer there. It took, rattling some cages in some certain, realms of politics and whatnot. So I completely agree. We just have to figure out who we prioritize and how we do it.
I'll definitely help you with that.
So Michael first and then Colleen, please.
Well, from what Margaret just said about rattling some cages, I hate to politicize anything, but I think we need to have Supervisor Gore make the phone call to behavioral health and be available for our experts like Margaret, Colleen, and the police chief and Debbie to be part of that task force or that group to talk about these consistently.
Thank you, Michael. I think you're right. And Colleen, go ahead.
Okay, so I'm wondering if we could invite Tina Rivera to make a presentation to our city council so that we can get from a very high level what the plan is for this specific problem and see whether they accept our invitation and what they have to say and make it very public. And maybe that would elevate this in a way that they take some action. Because if the answer is, we don't have a plan and we're not willing to come up there and tell you that because I know your tax dollars are being wasted up there in Cloverdale, I doubt seriously they're going to take us up on the offer, but at least it would provide them with some opportunity to be accountable.
Thank you, Colleen. So would everybody be accepting if I started an email offline of this committee to like another subcommittee that was the main players that could push this behavioral health angle between the chief, those that were speaking with Margaret and Debbie and everyone along those lines, and kind of go that direction to see if we can get any response from them. And or if you want to start it because you know everybody too. Okay, I'll start it. I'll send out an email, and if anybody needs to be added to it, please feel free to do it. I don't know everyone, and you guys do. So we definitely need to
Bill Carter is the director of Sonoma County Mental Health, so I would think you would want to send into it. I'm on a great deal of their board meetings and their executive board meetings, and I can attest to they do not do very much. And he reports to them, so I think, he would be the first stop.
Perfect, thank you, Debbie. If you don't mind, Margaret, I'm going to pull in the attendee. I see Angela Cordova has a hand up and it's been there a while.
Yeah.
Can we get her, please?
Yes. Let's unmute. She'll need to unmute. There we go.
Hello?
Hi, Angela, we're here.
So, I've listened to all this, and it's obviously the same stuff that keeps being said over and over. I don't understand what these programs are truly doing, because I referred a young mother of 2 that was facing homelessness. She couldn't get return calls, finally got return phone calls. She fell behind on her rent, fell behind on her PG&E, and she reached out for the services only to be told that it doesn't fit her criteria and that she has to sit on a waiting list. So she's going to go move and sit on a waiting list and then end up homeless. So you guys have this, you know, preventative homelessness, but yet the people that are trying to get it don't qualify. That makes zero sense. I do know about the homeless man who's living out on the river and has a job and unable to get assistance from any of your programs, and unable to find housing because of a stupid assault charge from way back whenever. And, you know, but he's working and he's trying and he's trying to be sober and clean and has this job, but yet again, no programs available to him. It seems that the funding goes for the drug addicts or the people who abuse the system by getting vouchers every month. Are these people screened for assistance? Are they put on waiting lists? I don't think so, because they're getting these vouchers every month. Most drug addicts, they receive income from SSI, disability, tribal income. They don't have debt. There's no debt to income ratio that they're dealing with. They're working. These people that are trying to get help are working. They're struggling. They get screened. They get put on lists for months, even years, to no avail. Nothing comes their way. I want to know exactly how you are categorizing the homeless, because I recently had to purchase a travel trailer for one of my sons and bring it to another county so that he would not be homeless, because he too cannot find housing, not only in Sonoma County, but where he's at now. And he has to park it in an RV park. And then every few months we have to drive down there and move it, because they have the rules and regulations where you can't stay steadily. So he too, what services does he have? Is Jody at Alexander Valley going to provide housing for him, or my adult daughter who also is having to stay at my house? Do I just categorize her as a couch surfer and then she falls under the homeless criteria? And I'm not being a smart.
Angela,
I'm
this is
just
exactly what we were talking about at the last meeting, Angela, is this exact thing, and that's what we're bringing up now.
Okay, well, I'm not done yet, Todd, so please let me finish. I let you finish, so let me finish, okay?
You got about 30 more seconds,
The
Dan.
police chief, okay, anyways, I'm not gonna argue with you and waste my 30 seconds. The police chief is spot on. He's been saying this. We've been saying that at every single meeting. Focus your energy on Laura's Law. Pull those three, there's 3 people right now that need serious help because they're literally rotting away on the street. But what is the difference at this meeting opposed to all the other meetings we've had that we've been identifying these people and asking for these people to get help? Now this meeting, all of a sudden everybody wants to help them. It makes no sense. You know, I had these programs when in my early years, 17, 18 years old as a young mother, and I got help from Catholic Charities, the one-time deposit for my apartment. I got help from Salvation Army for the one-time pay my PG&E bill. These programs are not helping people. They're all being put on waiting lists. Figure out how to get these people help immediately, screen them, figure it out and help them, because you're not. It's the same thing every meeting. And now just because the police chief said, oh yeah, let's get on the ball here and get these people help, now everybody wants to perk up. We've been saying it for months and months and months. There you go, Todd. Now you could have the floor.
Thank you, Angela. Appreciate it. Debbie?
You know, I thank you for your frustration, expressing your frustration. I've been expressing the same frustration for 20 plus years, and it is frustrating. And we deal with it every single day. So, you know, I get it. We're not going to fix the system. We have to create our own system, and that takes financial resources and commitment from not only us on this committee, but the city, at the city level, and at the community level. And so far, this community has been completely opposed to any kind of homeless shelter, emergency housing, anything like that. So I don't know. There's funding out there. We could do something, but we've got to have support from the community and from the city. And I think that
It's about a shelter, though.
They've demonstrated our willingness to do the work over and over again, and we'll continue, because that's our job, and that's what we are passionate about. But we need a support, and I'm not one that says, you know, I'm not waiting for Laura's Law. They'll be dead by then. I mean, that is just not feasible. We have to do something locally. And so if we want to help people, if you want to be able to put the person with the child into an emergency shelter or get funding from a city fund that's developed or whatever, then that's what we need to talk about. That's what we need to do. But to say we're doing nothing is not appropriate.
But this isn't about a shelter. The people don't have to stay in the shelter. You know that. Petaluma is at 50% capacity because nobody wants to stay there. So you put a shelter in Cloverdale, they're not going to go. And if they go, it's going to be.
And so this is where it gets bigger than us, and that's why we're trying to do what we're doing, is dragging the county into this, because
So
they
what are
don't.
you going to do?
They
Open
won't
up a
need stuff. And so
hospital?
you saw what's going on in Roanoke Park right now, right? You saw what's going on in Roanoke Park. They're trying to shut down a school, literally, to put homeless in it and give the homeless a dog park and a cafeteria and somewhere to sleep. Is that what you want in your neighborhood? No, of course not. So we have to find these solutions, and that's what the county likes. That's a real easy solution. They just take over a school, hand them $1 million and call it a day. That's not what we're about here. We're trying to fix these things, and we're trying to help these people, and we're having to drag these people by their shoelaces, sorry, almost said something else, to get them here to help us. And that's the problem, is the little stepchild that we have up here called Cloverdale, nobody wants to be here to help us. Like I said a little bit ago, Hart refused to come up here. I don't know what to say. The sheriff's office was standing there with me. They wouldn't come up. So we have to find our own, because I guess that's how we are, is we're on our own. Leanne, I see your hand next.
Hello, everyone. I've been missing for the last few months because I had my granddaughter out here and then I had to come back. But let me just say, this is a hamster wheel of nothingness. There are people suffering in this town and you don't care. You just do whatever you want.
Now, Leanne, do you go to the same things that we do? Leanne,
if people are,
I've had enough of this. Every meeting you say the same hamster wheel comment, and you see that we do care. We spend so much of our time doing this, trying to get everyone that's higher than us involved. I don't have millions of dollars in my pocket to release, or else I would.
it's not about money, dude. This is about people. Do you understand that this community is engaged with these 3 people that you're talking about every day? I engage with them. I talk to them. They're not in coordinated entry because they don't receive SSDI or any other government funded income.
That's not true.
That's it. That's the truth.
We know, Leanne. My clothes or clothes that I purchased, they use my money to spend on food. I talked to the one woman that we talked about. I talk to her every day. I bring her backpacks full of shit.
Right.
Don't forget by.
I agree.
Because the county and the state won't help. So you don't sit here and say that these people won't do anything. So everyone here works their asses off. We've had enough of that. Be part of the solution, Leanne. If you're out there helping them and talking to them, get a hold of the county, the people above us. Talk to people that vote.
No. I'm not doing anything with the county because they have proven to me that they're liars and they're corrupt. In my face, I have video evidence of that crap. I tried to participate in a homeless count in 2020 and they freaking.
We've been hearing this every month. We know and we don't dispute it. We have new people from that company to help get these people the help they need. We don't have those people here, so we need to move forward from that. Not saying you're lying or anything.
No, it's just a community effort. It's a community effort. This community has taken care of ourselves for years, and the county has consistently turned their backs on us and used us to get money for organizations like Reach for Home in Healdsburg.
Okay.
If you want the evidence, I'll be glad to give it to you, Todd.
So I've known Bonnie for over 40 years. This community has supported and taken care of Bonnie for 40 years.
I know.
So
I talk to her every
thing is a slap on our face and unacceptable. So I would appreciate
I talk to her. I talk to her every time I see Bonnie, I talk to her in person. Laura's Law needs to be the priority,
We
period.
don't have the power to do Laura's Law in this
So then
room.
with that.
Oh, please. Oh, please. Oh, please.
And with that, we're gonna move forward on our next topic, which is the letter of support for the Board of Supervisors regarding Laura's Law. Because we as a committee want to bring it to City Council to push the county, who now, because of the way we have been handling things, is revisiting Laura's Law. So with that said, we are pushing on them and it is getting somewhere. And so we want to write a letter of support to the Board of Supervisors regarding this to show that our town wants them to support Laura's Law, even if it will take years to get somebody help through this. It's still a step in the right direction. David, do you mind?
Chair, yeah, please, thank you, Chair, and Madam Mayor. Yvonne, if you would mind, do a share screen with the known supporters of Laura's Law. I'd like to start there. So based on the feedback that we received, through this discussion at our community advisory group over homelessness, we understand that there is a real need for our Board of Supervisors to consider adoption of Laura's Law. There are, based on our research, there's at least 17 counties in California that have adopted implementation of Laura's Law. And since its adoption, we're finding that Laura's Law has been effective at accomplishing a number of things, including reducing hospitalization rates, kind of getting to the chief's point, pretty significantly reducing incarceration. Also, which is why we're here, reducing homelessness and reducing the burden on our emergency services providers from not only police, but our fire department and our fire district, as well as Cloverdale Ambulance. And then not to mention the burden that it puts on our nonprofit organizations and our healthcare providers in trying to provide and care for individuals that are experiencing what we all know is really mental health, a mental illness. Our board previously kind of took up consideration of Laura's Law, and at the time there wasn't sufficient support for Laura's Law. But I think they're starting to come around to seeing that the data is suggesting that it's really particularly beneficial for some of the issues that we're experiencing. And as a result, what staff prepared is a draft letter of support for adoption of Laura's Law. This is a letter that's shown on the screen here. If this committee so recommends, I would bring this forward for full city council consideration for signature by our mayor and vice chair, Marta Cruz, as well as vice mayor and chair, Land. And this could be an opportunity for other organizations that are participants in our community advisory group to write a corresponding letter of support to go along with this letter. But this what you see on the screen is a draft addressed to Chair Hopkins and the board. It is dated today. Ultimately, this would need to go to the city council to get support to forward this letter to Sonoma County. But the intent is, again, to reflect that Laura's Law has been successful in other counties at addressing, again, hospitalizations, incarceration, and homelessness. And the data speaks for itself. And it's really about redirecting what are already approved resources towards specifically addressing some of these mental health issues. And that's the intent of this letter, is again to reflect what's been an outcome of the discussion amongst this committee, and to ask our board of supervisors to reconsider their position on this. Again, this draft, we're happy to amend it in any way that would better reflect the discussion that this subcommittee had, or this committee's had, before bringing it to the board, or bringing it to city council for further consideration and ultimately approval for the signature by the mayor and vice mayor.
Thank you, sir. Appreciate you doing this. Any comments or questions?
And I'll just comment that in implementing Laura's laws or adopting Laura's law in the county, then they have to have a program set up to address the people that would be affected by the new law. And that was the county's reason for opting out, because they didn't have the funds to set up a program. And I recommended that they take the money that they would save from the police department, and they can't cross funds, you know how that works, right? So, so now there is a lot of resources right now, and there has been for a long time, but I think it's a perfect time.
Even if they're not using Laura's law to the T, it shows the direction that the county wants to be in. There are a million other ways to do this. It's just that this is one resource. And so it just shows that I know that a lot of people are against the whole idea of, locking people up against their will. However, if you're out here on the streets and your fingers have maggots and you're eating mustard all day long for breakfast, lunch, and dinner, you're not of right mind. If you're jumping out front of cars, you're not of sound mind. If you are crapping your pants and walking around town with it, you're not of sound mind. There's things that we need to help them, because sometimes the best thing for them is the stabilization they'll receive. And that's why I am a huge proponent of this. Even if it's not the end all, it's the start. And that's why I don't think this will ever get used for any of our people. I think that this is going to be just showing direction that, they'll get help, and it won't be through Laura's law, but it'll be something like it. That's my 2 cents. I can't see any hands. Yvonne, is there anybody, either side, panelists or attendees? And Yvonne, you're muted.
There are a couple of hands. Angela Cordova.
Okay,
is-
start with Angela.
Okay. Angela, you can speak now.
Thank you, Yvonne. So earlier you stated that Cloverdale doesn't want to do anything. Nobody wants to cooperate. Nobody wants a shelter. It's not about a shelter. A shelter is somewhere for them to go willingly. They don't want to go into a shelter. And the ones that have the, mental issues, they're not in the right mind to make those decisions, as Todd just said. So this isn't about putting a shelter in Cloverdale. What I want to know is, what is your goal? Is Alexander Valley trying to open a mental hospital? Trying to have something like that in Cloverdale? I don't even think that's necessary for the handful of people that we are dealing with on a regular daily basis. And that is where our concerns are. And I don't know whoever was talking earlier and saying that nobody in Cloverdale wants to cooperate and nobody, it's not in my backyard. I don't know who was saying all that earlier, but that's not the case. We've done everything. We're dealing with people. The people that want help are getting it. The people that need help are not. The people that need the help cannot even make those decisions. The people that don't want help are still pillaging our community, just so you're aware. So when you say that Cloverdale doesn't care, you're dead wrong. We're helping those that need it and that want it. The ones that don't, yeah, they're categorized as homeless, but they got nothing coming. And they're going to get resistance from the community and anybody else because of what they're doing in our community. But I'm assuming you don't live up here. Putting a shelter.
Angela, you're cutting out, Angela. We're losing you on.
We have the small police force we have. That's not a very genius idea.
So thank you for your question, and I'll answer a couple of things right off the bat. No, we are not looking to open a mental health facility in Cloverdale. We have our hands full. I have lived here for 39 years, and I have been in the same position for over 20 years and have been dealing with this issue for over 20 years. So I definitely know what the community is about, what it's about. When I talk about shelter, I'm not talking about a shelter in the sense that you're talking about. I'm talking about an emergency spot to put people, transitional spot to put people. We have a housing shortage. Everyone knows that. A housing affordability issue. We need housing that we can refer them to. We don't have it, okay? That's the bottom line. So when I'm talking about any kind of overhead shelter or system or program for the homeless locally, I'm talking about transitional stuff. I'm not talking about permanent shelter for homeless, anyone that comes along. But we have nothing, okay? So that's the bottom line. We have nothing. And as far as working with the homeless, I've been working with the homeless for a very long time as well. So I definitely am always looking for people that have answers and have solutions and have ideas. I think that's awesome. And I have to say, I agree 100% with Todd. We have to do it locally. If we want the problem to get addressed, we have to deal with it locally.
Thanks, Debbie. Yvonne, the next hand, whoever it is.
The only hand I see is Angela, and I believe she's already spoken.
Okay, thank you.
Mhm.
Let's go back around the table. Anything? I know I would support the letter 100% if it was brought, and I'll read over it to just see if there's any tweaks or anything. Mayor?
Same thing here.
Okay, great. Let's move on to recap survey, homeless survey results.
Yeah, I'll take this one. Yvonne, can you put up the presentation I made earlier?
Yes. Second.
So just a little summary, a little background. This whole group was formed when we put together the homeless strategic plan framework. And we started working our way through all the implementation items and supporting actions that are contained in there. COVID hit, so we kind of let it go to the side. Just a real quick about the homeless strategic framework. It has 7 goals and 36 supporting actions. You go to the next slide, please. You may recall I was before this group a few months ago, and we were kind of saying, wow, there's 36 supporting actions. That's really too much for such a small city. Let's try to whittle that down and get to something that we can, actually work on. And so we put a survey together, asking folks to rank the 36 supporting actions. We did get 56 respondents, which isn't a ton, but it's something. So I'm going to try to summarize what the top 10 were, talk about what we're doing with those real quick, and then maybe brainstorm a little bit on what we could do to further those supporting actions. So next slide. So the top 10, there's clearly a category that started emerging when we started looking at the top 10. Public safety, prevention of homelessness, lobbying efforts, and outreach efforts. So this is just a summary of the top 10. Clearly, the really high ranking ones have to do with property protection, fire protection, things like that. So these are the top 10 summarized, and if anyone wants to see what the supporting actions are contained in the framework plan, I have those as well. I just thought I'd summarize those. Next slide. So of the top 10, we've got 3 for public safety, 3 for outreach, 2 for prevention, and 2 for lobbying efforts. So that's where we focused. Next slide. So what I did here was I tried to take those 4 themes that we saw in our top 10 supporting actions from the plan and try to summarize what we're doing towards those efforts. And this is where I kind of was going to ask the group for some help to see if I've missed anything. And this is really just a summary. I mean, if you look at this, you look at our 4, if we're going to say that we want to continue with the top 10, from 36 to 10, based on the public comments that we've gotten, given the scope of what we can actually accomplish with this group, we're doing some stuff here, and you can see it's summarized here. So, public safety related to fire, Vice Chair Land has been leading up our efforts to clean up the river. Mayor Cruz, you guys have been working on that, and that's turning out really good. fire department, police department, and the public safety, the homeless outreach, St. Vincent de Paul again is up and running again. Reach for Home, providing low barrier service. Street medicine, the Gospel Mission Church is providing the showers. The prevention, this one came up on two separate ranking top 10s, was how can we keep folks from becoming homeless? We know that Sonoma County is offering emergency rental assistance, so people can fill out online, and I'm not sure exactly if there's another way to do that. Debbie, you may know more about how that's.
Reach for Home, they can also apply Reach for Home.
Reach for Home, okay. And then St. Vincent de Paul is working on eviction diversions through seasons of sharing. And I know they just came up and running, and that's a way for somebody to get a couple months of rent, I think fairly easily. And I haven't been through the process, but that is another way to in the prevention category. Our lobbying efforts, we just had a discussion with City Manager Kelly about Laura's Law and how we're going to move forward on that. And then I think, Councilmember Lands and Vice Mayor Lands and Mayor Cruz are talking to Supervisor Gore and McGuire on a regular basis about our lobbying efforts and what Cloverdale needs. So this is what I summarized from our top 10 action items. So I don't know if anyone has any more that we could add to this. We can just kind of brainstorm a little bit. And then maybe if there's other ideas on ways to work on it. I guess I'll take it a step back first. I mean, are we kind of in agreement that these top 10 would be something that we would want to focus on, and then maybe leave the remaining 26, in the plan, but not focus on them given the scope of our efforts here? So I don't know, that sounds like kind of a first.
We have to go with what's workable,
Yeah.
sustainable. This definitely is an effort that we can continue to engage on an ongoing basis.
Yeah, it does have some, community input. We've only got, I think, 54 survey respondents, but these were the top ones that came out of that. So, in our efforts to promote the survey, we did our best, and it was kind of long. I understand people probably got halfway through and decided they didn't want to do it, but the whole point of it was to whittle those down. So again, this sounds like these seem like notable efforts that we could focus on. There could be some splintering of this group, maybe to assign tasks under these particular 4 measures. But in any case, can we go to the next slide real quick? What I'd like to do is, based on our input that we just got now and our survey results, amend our strategic framework that is currently now a framework to highlight those 10, present it to the council for possible adoption, and continue to monitor those 4 and bring forward ideas as needed. I understand that this is a paper thing, and people get frustrated and they want action, and I understand that. And frustration in this group, we've seen it through the months that we've had, and we need action immediately. And the paper part of it, that sometimes, it's a little frustrating because actions aren't happening. But I think at the same time, it's still a good idea to have a plan that we've adopted for things like if funding's coming down, we have an adopted plan for homelessness. It just bolsters our case that we've taken the time to go through a plan, we've looked at it, we've discussed it, we've done surveys, and if we want to convey that this really reflects what the community is looking for in our homeless efforts. So David, I don't know if you wanted to add anything to that, but.
Well, I think you captured the next step. I think what Kevin's speaking to and what we're identifying is the high priority items. And I think what's reflected is we're actually making progress on implementing.
Can you go back one, Yvonne?
What are the key and high priorities? I think there's been some additional discussion that maybe isn't completely reflected in this draft framework about this local coalition that is going to be working on addressing, our specific Cloverdale needs. And I think that's something we might be able to also put in as a priority as we continue to develop our local organizational capacity around homelessness. overall planning effort, and to rally and get support for that as part of, our solution in terms of trying to, we want to continue with those other efforts to continue to argue for funding, to continue to argue for change, but all the while continue to be doing some of the hard work at the local level to address the issues that we're experiencing, both from policing, but also our nonprofit organization, and to reflect that in our funding effort. And I think as Kevin mentioned, that we are seeing this funding availability, and if we have an adopted plan, I think that helps. You can check that box when it comes to grant applications, and also hopefully helps the nonprofit organizations like Reach for Home, Alexander Valley Healthcare, the Wallace House, when it comes to looking for funding, because you're trying to implement an adopted plan that's accepted by the city council.
I would, yeah, just quickly, because I have to move on to comply with the demand at the chamber for already. But this is frustrating for many people to see all these paperwork and so on, but it's essential because it's required when we apply for grant money. And if we cannot prove what we've been doing, what we've been discussing, and who are the stakeholders, we cannot really present a case of what is our concern, what is our engagement, and what have been our short-term results. So I thank all of you for being here and for supporting this effort. I will be in touch with Vice Mayor Lamb to work a little bit more on the letter and some other updates that I need to share with him. And right now, I need to leave the meeting, but I'm supporting all of this. I think we're on the right track. We just need to not give up. We need to keep thinking we are capable. We have strong community. We have resources that we are tapping on, and we need to continue to research all that we can so that we don't get burnt out. Thank you.
Kevin and David, I would just add that two things. Number one, I think we really need to have our plan that is classified by home categories per se. I mean, there's a difference between the 4 individuals we're talking about and the 60 in Cloverdale we serve and the 40 we serve that live outside of Cloverdale, right? And so I think that would be a good thing. And the second thing that we may want to look at is contacting with a homeless provider that comes to town and provide services.
And Debbie, to your point, one of the things that we've left blank that I think we could elaborate on is on page 6 of the draft framework. We talked about the different homeless categories of homelessness, whether it's persons living in the street, persons living in cars, or in your RV, or makeshift shelter, whatever that is. So, we can work with you on kind of getting those numbers. And, again, it's going to be a snapshot in time, but our goal, again, would be to track it over time and see how are we doing in terms of reducing those populations. So I think we can work with you, kind of get those numbers, what the categories are, and then what those numbers are, we can plug them in, for a specific time frame and say, these are the things we're going to track over time as part of our coalition, and then see how we're doing.
Yeah, and this plan would change. I mean, this is.
No, it has to be good.
And we could even make it a standing item on the committee if we want to. Just review this, but I think it's really important that we get something before the council. We've been working on this for a long time and get it adopted. That way, we have a plan.
This is why we were talking like spreadsheet, because it can be updated and brought to you every month. And it doesn't have to show names. We talk about having names for certain things, but certain people get names when necessary. You're going to look for it. However, when it's brought here, we can say, look, this person was offered and refused. This person was offered and took it and they jumped out. This person took it and they're gone. They're doing great, kind of job. Whatever. So, all right. I don't see any other hands. So with that, I'd like to thank everyone for their participation. I told Margaret. Margaret, did you need something? Or something else?
No, I'm good. Thank you, though. Thank you, everybody.
Well, I thank everyone for their passion in this, because without it, we wouldn't get anywhere, and we'd still be having the same meetings that we started with 2 years ago, and it actually progressed from getting somewhere. I like it. So Without this, it wouldn't be successful and we wouldn't be getting people help. So I have a list for the offline meeting that we talked about, the health and behavioral services, and in that direction. And our next meeting is set for, I think it's on here. It's not on here.
Second Tuesday in October.
Correct.
Let's see it.
I want to get it wrong one.
It should be October 12th.
Yes. October 12th, next meeting. And that is at 1:30 here. No, we're doing,
We have been switching.
switching this 5 to 5:30, right?
I
I don't remember what it was. What was that? What's the one on there? So what's the last one? I don't want to be wrong.
That one was 5.
That was 5?
Yeah.
All right, so it'll be October 12th at 5 o'clock. In this meeting, in hybrid or something changes, it will be listed on the agenda. So thank you all, and this meeting is adjourned at 2:58.
Thank you, everybody.
So,
Thanks, Yvonne.
Thank you.
Thank you.
Thank you.
Michael wants you to call him.
Bye, Yvonne.
Bye.